My name is Pritam Steiner, and I'll be sharing with you my culminating student experience discovering the role of the clinical nurse leader as a team manager and leader. The organization in which I'm currently practicing as a MSN CNL student is a large 327-bed nonprofit hospital that serves 7 surrounding counties. Full-time staff is composed of nearly 500 physicians and 410 registered nurses. And as you can see, the average yearly patient census is high, whether it be admissions, inpatient or outpatient surgeries, or emergency room visits. This organization requires extensive resource management, both human and fiscal, as well as commitment from quality and leadership departments to ensure that each microsystem is functioning fluidly within. The CNL would be an excellent addition to such an organization, as this role would be able to bridge the gaps between micro and macro system needs among both the in and outpatient settings. The clinical nurse leader embodies countless characteristics that represent nurse leadership within a complex microsystem. As an advocate for patients, point-of-care staff, and the multidisciplinary team, the CNL takes on the vital role of communicator between and across the continuum of care, strengthening the functioning of a microsystem while considering the resources, barriers, and limitations that may arise. As a member of a profession, the CNL role connects and builds relationships with others in order to steward and effect positive change. The CNL is an agent of change while also encouraging others to stimulate change in order to enhance patient outcomes and microsystem functioning. The CNL has the ability to manage care, but also organize and take responsibility for team, information, and system management. As a clinician, the CNL designs, coordinates, evaluates, and delivers care to a specific cohort of patients while maintaining a strong focus on the specific needs of a microsystem. And finally, as a clinical outcomes manager, the CNL synthesizes data relative to an aggregate of patients and focuses microsystem education on delivering current evidence-based practice, enhancing patient care, and increasing staff morale. In reviewing the course material, I've been able to identify the connection between the CNL role and microsystem functioning. As leadership in my microsystem was discussed during the first week, I found the connection between the CNL serving as a partner on the interdisciplinary team. When outlining my project and my microsystem, the role of evaluating and coordinating patient care became clear, and the significance of the CNL in streamlining care processes was undeniably related to the ability of delivering quality care to patients. The concepts of yin and yang and faulty leadership provided insight into leadership qualities needed in order to properly delegate and manage care across the continuum of healthcare. When discussing moral courage and team communication, the role of the CNL in bridging gaps to maintain working relationships was identified as a key component to staff engagement in patient-centered care. The most critical lesson was learned when I began synthesizing the vision of the team and the microsystem and how it would relate to my personal vision. The CNL role in reaching a shared vision is most successfully achieved when the CNL integrates theory, evidence, clinical judgment, research, and interprofessional perspectives to enhance practice and outcomes for patient aggregates. Overall, my work over the past few months has shown me the flexibility of the CNL role, enhancing my excitement about this innovative and much-needed leadership position. Key Issue 1 shows the importance of multidisciplinary teamwork and communication. After identifying each role within my complex microsystem, it was apparent that every role was needed in order for the microsystem to function and for team visions to be achieved. The CNL role must act as a mediator, exuding transformational leadership qualities by being communicative with staff across the continuum of care, encouraging others to take on leadership positions, and become agents of change themselves, and lastly, to take risks and go above and beyond to reach the common vision. Key Issue 2 reflects the need of a CNL to evaluate and coordinate patient care delivery. An in-depth microsystem analysis by identifying the 5 Ps purpose, patients, professionals, processes, and patterns allows the CNL to assess by envisioning goals and identifying barriers, diagnose in order to achieve a workable unity among the care team, and implement by explaining, managing, educating, and fostering an environment of inclusion. Through the microsystem analysis and during the implementation process, the CNL role must serve as a symbol, represent the group, renew, motivate, and affirm values. It is these qualities that will gain the CNL followers and allow the CNL to take on the many challenges faced within a complex adaptive system with the support of the entire care team. Key Issue 3 provided insight into the needs of care delivery across the continuum of care. My story for this week revolved around interdisciplinary communication and collaboration skills through the enhancement of both convergent and divergent group situations. What I realized this week was that integrative interdisciplinary skills day sessions were lacking among the various pediatric microsystems. The issue became clear when skills days did not allow for collaboration among the different settings, and is when I identified the need for didactic multidisciplinary teaching sessions where the emergency department, pediatric ICU, and medical surgical units would work together to achieve unity and an enhanced understanding of the interconnectedness of each individual microsystem. The CNL could play a vital role in developing skill sessions geared at managing care across the continuum of care, by fostering communication and guiding others to become leaders by providing them with the opportunity to become nurse educators in their own area of expertise would enhance the overall care delivery process in and across all environments within a complex adaptive healthcare system. Key Issue 4 brought about the importance of building and maintaining working relationships within the microsystem. This includes involving patients and their families in the plan of care and being acutely aware of one's own moral courage, certitude, and arrogance. The story I shared revolved around ethical decision-making and our individual morality being tested every day as nurses. Our ability to act in the moment, cope with situations we don't always agree with, and heal from emotionally distressing situations is an area of nursing that has been identified as needing more attention. I praised a colleague for exuding qualities of moral courage and for ultimately having the ability to achieve moral courage through the capacity to display compassion, strong communication skills, collaboration with the care team, and by having cultural sensitivity. The CNL must bridge cultural barriers by setting aside his or her own beliefs in order to understand the values and beliefs of others. In order to bridge gaps in care, the CNL must communicate with the care team by asking, affirming, assessing, and acting in order to encourage moral courage in others and to develop empathy towards patients and their beliefs. Key Issue 5, as expressed in our final writings of the semester, touch on the integrative process the CNL must use to achieve a shared vision among the microsystem. The multifaceted role of the CNL allows for the development of innovative solutions to enhance care delivery and outcomes for a specific group of patients. As I expand on my microsystems vision and how I will contribute my own passion to the overall vision, I've identified 9 ways I would like to be viewed as a leader. I would like to strengthen my adaptability, emotional intelligence, while being charismatic, authentic, resonant, mindful, servant, strength-based, and storytelling. It is these qualities that are valued by others, and in order to integrate these ideals, I will have to draw on personal experience, clinical judgment, as well as the strengths of others within my team. My project vision of enhancing the delivery of patient-centered care will prove the value of the CNL role by showing both quantitative and qualitative short and long-term benefits. My microsystem analysis was conducted using the Great Big Green Book from the CNL Toolkit, which is pictured to the left. This in-depth analysis has allowed me to conduct an extensive 5P analysis on my own microsystem. The purpose of the microsystem is to deliver nursing care that is high quality, evidence-based, innovative, and patient-centered, all of which reflect my own project vision of enhancing education regarding central line care among the pediatric population. The goals are to increase patient satisfaction and confidence, and staff satisfaction and morale, and to decrease costs related to central line associated bloodstream infections. The population at hand is high-risk pediatric oncology patients who are immunocompromised due to the nature of their treatment regimens, long hospital stays, and the presence of central venous catheters. This population requires extensive parental or familial support and responsibility regarding central venous catheter care. Parents or caregivers are expected and encouraged to perform dressing changes, blood draws, and cap changes upon discharge from the hospital. However, after conducting extensive patient interviews, I found a common concern expressed was that parents feel fearful of providing such invasive care to their children without the guidance and supervision of a healthcare provider, and that education is lacking prior to discharge. The care team is comprised of nurses, case managers, and physicians, all who are dedicated to providing quality care and patient education. Nurses are experienced, motivated, specialized, and able to educate patients. However, barriers identified include time constraints, high stress levels when acuity and census is high, as well as having a lack of supplemental tools for education. The case manager is a registered nurse who is extensively involved as an educator, however faces limitations when trying to streamline care delivery across the in- and outpatient settings. The oncology specialists would benefit greatly from knowing the limitations and concerns expressed by the patients and their families, as well as the nursing staff, in order to enhance their own methods of patient education. Some of the processes I noted showed inconsistencies across the continuum of care. For example, dressing change policies varied between other hospital units and the pediatric units. The hospital changes dressings every Sunday, whereas the pediatric units follow whichever schedule the family is on once they become rehospitalized. Another is that dressing changes are performed using sterile technique in the inpatient settings, but taught to patients using clean technique in the outpatient settings. So some of the pros identified with following family schedules are patient satisfaction and autonomy, but some of the cons are decreased compliance and decreased continuity of care due to the confusion that arises with the inconsistencies across these different care environments. The most pertinent pattern identified are that patients require education throughout the entire care process. Central line education should be implemented during initial admission, throughout hospitalization, upon discharge, as well as at each follow-up appointment to ensure that caregiver competencies are adequate. Patients and families report being overwhelmed by being provided too much material immediately after cancer diagnosis, as well as immediately prior to discharge. So it is vital that education occurs on a continuous basis, utilizing supplemental teaching techniques geared at individual patient and family needs. My Project SMART goals include to improve central venous dressing change procedures and educational materials in the pediatric inpatient setting by having lead team members analyze data from patients over the course of 2 to 3 months in order to create educational materials such as skills videos for patients to access via the internet or DVD from home upon discharge. Evidence-based guidelines will drive new policies in central venous catheter dressing change procedures, and ultimately, patient education and satisfaction will be enhanced. Central line associated bloodstream infection rates will be reduced, and staff morale and skill set will be increased prior to my completing my final CNL role hours. This project is very exciting, and I look forward to taking on this challenge. Other key issues I would like to visit include creating integrative skills day sessions to enhance nursing relationships and continuity of care, streamlining outpatient central venous catheter education to what is occurring on the inpatient side, establishing nursing forums and leadership groups responsible for presenting evidence-based practice for policy changes, as well as quality improvement teams to identify microsystem needs. I'd also like to continue building on the media portal and produce additional skills videos for patients and nurses to access as needed. And lastly, I would like to integrate a frontline nursing staff representative to attend leadership and management meetings in order to streamline care across the continuum.